Good afternoon, my people. Welcome back to my YouTube channel. Welcome back to through a channel whereby we always get education and educational bangers each and every day. And for those who are new here, you know how we do it. It's just simply by subscribing, sharing, liking and commenting on our videos so that they may reach as many people as possible. And if you are there and you have not subscribed, what are you waiting? Thank you for making me part of this big family, because this channel is where it is because of your support. That's why I always appreciate each one of you who is doing anything, however little it is. I don't take it for granted. I always appreciate anything you are doing, however little it is, to push this channel ahead. And after subscribing, don't forget to put the notification bell on, so that whenever I upload a video like this, YouTube will automatically notify you. We have been discussing about bone lesion biopsy, which is a chapter we started some days ago. And today we'll start by looking complications associated with bone lesion biopsy. As we know, anything that has advantages, it should have its disadvantages too. So, complications associated with bone lesion biopsy. All surgical procedures carry risks of infection and bleeding, and this is obvious that all surgical procedures carry risks of infection and bleeding, which are greater for people with bleeding disorders or a compromised immune system. All surgical procedures carry risks of infection and bleeding, which are greater for people with bleeding disorders or a compromised immune system. This is important, and I'm repeating it for the third time, that all surgical procedures carry risks of infection and bleeding, which are greater for people with bleeding disorders or a compromised immune system. Make sure you tell your doctor if you have either of the risk factors we have mentioned above. Make sure you tell or inform your doctor if you have either of the risk factors above. These are bleeding disorders or compromised immune system. Let me repeat this again. Complications associated with bone lesion biopsy. All surgical procedures carry risks of infection and bleeding, which are greater for people with bleeding disorders, or a compromised immune system. Make sure you tell your doctor if you have either of the risk factors. What are other possible complications specific to bone lesion biopsies? So, other possible complications specific to bone lesion biopsies include the following. Other possible complications specific to bone lesion biopsies include the following. Number one, damage to surrounding tissue. If you are doing the biopsy, you can damage the surrounding tissue because you have to drill, and during the drilling, the tissue around that tumor, all around that bone, can be damaged. Number two, we have excessive bleeding. Depending on the site or where you are getting the biopsy, it might lead to excessive bleeding. For example, if you puncture or injure a vein or an artery. Number three, we have bone fractures. This involves drilling and it can end up fracturing the bone. Number four, we have infection of the bone or near the bone area. Maybe you are using an instrument that is not sterilized. This can lead to bone infection or infection of the bone or the area near the biopsy area. Remember, for you to access the bone, you have to go through the skin first to reach the bone. So this can cause an infection, especially if the instruments you are using are not sterilized. Let me repeat this again about other possible complications specific to bone lesion biopsies. One, damage to the surrounding tissue, and I've explained that. Number two, excessive bleeding. I've also explained that. Number three, bone fractures. I've also explained that. And number four, infection of the bones or the area near the biopsy or the biopsy area. The risks of these tests are significantly lower than the risk of not testing your bone tissue lesions. In medicine, we always say that if the advantages outweigh the disadvantages, then we have to go for it. But if the disadvantages outweigh the advantages, we can leave it. I hope you know what I mean. This means that if you are doing a procedure and the advantages of doing this procedure are more than the disadvantages, then you can do it. But if the disadvantages or the outcome of this procedure will cause more complications than the way it was originally, then you can stop it. So the risks of this test are significantly lower than the risk of not testing your bone lesions. Testing can help detect cancers or other serious health problems so that treatment can begin as quickly as possible. And this is always the main aim of testing or having a bone lesion biopsy. Testing can help detect cancers or other serious health problems so that treatment can begin as quickly as possible. Testing can help detect cancers or other serious health problems so that treatment can begin as quickly as possible. Another question we ask ourselves: what happens after bone lesion biopsy? What happens after bone lesion biopsy? After the biopsy, you rest in a hospital bed until your doctor says you can go home. After the biopsy, you rest in a hospital bed until your doctor says you can go home. So after the biopsy has been done, you don't just wake up and go home. You have to rest in a hospital bed until the doctor says you can go home, because there are also the side effects of the anesthesia. So the doctor has to be sure that the side effects cannot overwhelm you. You will be in charge of taking care of your incision wound. Remember the part whereby it has been drilled for the surgeon to get the biopsy, there is a wound. So you will be in charge of taking care of your incision wound, which includes keeping the area clean and changing your bandages. This is very important, that you will be in charge. You will be in charge of taking care of your incision wound. which includes keeping the area clean and changing your bandages. Your doctor will remove your stitches at a follow-up appointment. It's always after between 7 to 10 days. That's when the stitches are removed. Your doctor will remove your stitches at a follow-up appointment. So during your appointment or your follow-up appointment, the stitches will be removed. The site of the biopsy may be sore. The site of the biopsy may be sore, or it may feel a bit of pain for a few days after the procedure. The site of the biopsy may be sore for a few days after the procedure. Your doctor will go over the results of your biopsy at a follow-up appointment. Your doctor will go over the results of your biopsy at a follow-up appointment. They will tell you the results of the biopsy and outline a treatment program. He or she or the doctor will tell you the results of the biopsy and outline a treatment program. This marks the end of our video today. Thank you for those who have been following me. Thank you for your time, and let's continue subscribing, liking and sharing and support this channel to bigger heights. Have a fantastic day.